Bismillah. So I'm going to talk about the histology of the skin. Hopefully this takes only 5 minutes. It is composed of the epidermis and the dermis. Basically, those are the only two layers. The hypodermis or adipose tissue is not considered of the skin. The epidermis is the thin, most superficial layer. It's most thin in the eyelids and most thick in the acral skin, which is the palm and the soles. It is composed of keratinized, stratified squamous epithelium, which is in microscopic layers. You can find that you have the corneal layer, which is a nucleated keratinocytes with a basket weave pattern. Okay, there is the layer of a stratum lucidum, which is difficult to see, and they are usually in the acral skin to make it thicker. Then we have the stratum granulosum, which is very easy to see here. We can see that there are these basophilic granules of the um, nucleus being decomposed in here. Then we have the stratum spinosum. Spinosum means that it is spiny and it is having a tapered type of taper type of ends of the cytoplasm. Basically, there is a higher amount of layers of this one with desmosomes between them. We'll see that later. With the stratum basale, the stratum basal area, it's the lowermost area attached to the basement membrane, which is then attached to the papillary dermis, or the dermis. It has a hyperchromatic nucleus with a round shape or oval shape and a scant cytoplasm. Then we have the other things that we need to think about. The reed ridges are basically the papillary extensions of the dermis into the of the epidermis into the dermis. And then we have the dermal papillae. So epidermal papillae and dermal papillae, whatever you want to call them. Then we have the acrosyringium. This is a special structure, and this is basically the acrine or apocrine duct being coming out into the intra epidermal area, an acrine gland in this case. And then we have this layer that is the stratum lucidum. This is an acral skin, and it is difficult to really tell, but these white patches, these white areas are basically the acral skin, I believe. Then we have the basement membrane here. So it is very difficult to distinguish, but you remember that the basal cells have these desmosomes going in there. Okay, and you can also see the desmosomes in between the spinosal layer. Okay, and of course you have the granulosum layer and the corneal layer. There is this Langerhans cells, which are basically dendritic cells of the intraepithelial layer, and we have a very nice one here, okay, with the reniform shape, like the kidney shape. Okay, then we have other structures. So the follicular ostia an is an adnexal structure coming out of the dermis into the epidermis. Of course, this is your hair follicle. The ostia just means an opening. And then we have the melanocytes, which are an amazing type of cell, just producing this melanin, which deposits into the layer of the basalis layer, and just gives the skin the type of color that it has, basically. And we have Merkel cells, which are very difficult to distinguish from melanocytes because they both are of this very pale cytoplasm in the basal layer. Okay. We have this phenomenon called parakeratosis and other things that are phenomenon of the skin. But parakeratosis basically means that you have retention of the nuclei in the layers that they're not supposed to be, which is basically here the stratum corneum, the basket weave shape area. Um, this is an apoptosis. This is basically the basal cells, stratum basale. PAS stain is very nice to show the thin basement membrane, which is attached to the basal layer as well as the dermis. Then we have this dermis. The dermis is composed is in two parts. We can call it the papillary dermis and the reticular dermis. The papillary dermis is of very loose connective tissue with fine collagen fibers. There are mostly the type 1 collagen and a little bit of the type 2 collagen. And it does look very pale because it has mucin inside it. Okay, so there is this papillary projection and another papillary projection from the epidermis, and between them is the papillary dermis. We have some mucin in there and probably some vessels inside, and these are very thin capillaries supplying this area as well as the epidermis. Okay, then we have the Meissner's corpuscles, which are specific to the acral skin, again, the soles of the feet and the palms of the hand. It is this structure that you can see here, and it is related to the light touch sensation. Then we have the reticular dermis, which is more dense and much more eosinophilic, dark staining eosinophilic. It is a dense, irregular connective tissue, and it has larger vessels, the small and medium-sized vessels, and lymphatics, as well as nerve plexuses. Okay, so we can see the nerve plexuses probably in here, and there are larger vessels, lymphatics we'll see later. Okay, on this image of the reticular dermis, we can see that this is a pili muscle, the erector pili muscle. There are multiple adnexal structures, which are the eccrine and apocrine glands in here. And of course, they have their projections up there with the hair follicles. Okay. The neurovascular bundles in here, we can see that there are these glands again, the apocrine glands, and this is a nerve cell, and this is a vessel, probably an artery, probably this one is a vein. So this is the plexus that has the three different things, probably lymphatics in here, more better to see them. This one is a lymphatic vessel, and this one is another lymphatic vessel. They do not have red blood cells. This one's probably an artery or a vein. This one is likely an artery. Okay. Then we have the adnexal structures. Again, this shows them much better, connecting to the epidermis. So these are the sebaceous glands. They have very pale vacuoles inside them, very pale vesicles inside them. And we have a hair structure in here next to the sebaceous glands, so multiple hairs in here. Of course, this is going to go out on the follicular ostia into the epidermal outer layer. And in the reticular dermis, we have a special structure similar to the what do we call it? The Meissner corpuscle. This is the Passician corpuscle, and this one is more related to touch sensation. Of course, it's full of nerve cells, and it has this very similar look to the Meissner corpuscle. At least that's what I see. And there we go. Hopefully that wasn't long. This is from Lindbergh Elsevier book, The Normal Histology. And that's all I can say. Hopefully that was helpful for anyone who's watching. Take care.